This video reviews the instructions for the Bravo test. You will also be given written instructions to refer to. The reason for reflux testing is that everyone has a small amount of acid that comes up from the stomach into the esophagus. GERD, or reflux disease, happens when more acid and fluid than normal comes up into the esophagus and causes symptoms. The Bravo capsule can measure how much acid you have coming up from the stomach into the esophagus. The Bravo is a small capsule that is placed in your lower esophagus that senses how much acid you have coming up from your stomach into your esophagus. The capsule sends the information to a receiver, which is about the size of a pager. You will need to keep the receiver with you during the test. The test will last either 48 or 96 hours. The receiver will need to be returned to the office at the end of the study. The capsule will fall off after 7 to 10 days and will exit the body when you have a bowel movement. Because the Bravo is measuring acid, you will need to be off of your PPI medications such as Nexium, Prilosec, Dexilant, Prevacid, etc. for 7 days prior to the study. You will need to be off Pepcid and Zantac for 48 hours prior to the study, and you will need to stop Tums and Mylanta after midnight the night before the study. During the study, it is important to keep the receiver within 3 feet of you at all times. When you sleep, it is best to keep the receiver under your pillow. If you place it on your nightstand and roll away from your nightstand while you are sleeping, the connection can be lost. You may shower, leaving the receiver outside the shower during the test, as the receiver cannot get wet. During the test, you may eat and drink normally with a few exceptions. No gum, hard candy, or breath mints. Do not sip on water all day long. Just drink a glass of water and be done for a while, as water can neutralize acid. Chew your food thoroughly, as the capsule in the esophagus can give the sensation of food sticking. Some patients will have discomfort in their chest when they swallow. This is normal and should pass when the capsule dislodges. If the pain becomes severe, please call the office. During the test, we need to know when you start and stop eating or drinking. This is for anything that goes in your mouth during the test, except for plain water. Before eating or drinking, push any button on the receiver to wake the receiver up. The screen should turn on. You will then push the button with the fork and knife to indicate you have started eating or drinking. A small green light next to the fork and knife will flash. When you are done eating or drinking, again hit any button to wake the receiver up, and the screen will turn on. You will then push the button with the fork and knife on it. The small green light next to the fork and knife will stop blinking. It is also important for us to know about body position. When you lie down, push any button on the receiver to wake the receiver up. The screen will turn on. You will then push the button with the bed on it. The receiver now thinks you are lying down. A small green light next to the bed will flash. When you get up from lying down, hit any button on the receiver to wake the receiver up. The screen will turn on. Push the bed button. The small green light next to the bed will stop flashing, and the receiver now thinks you are upright. The 3 buttons in the middle with the triangle, circle, and square are not used during this study. You may continue all of your usual activities during the test as long as you remember to keep the receiver within 3 feet of you. You may shower, leaving the receiver just outside the shower as the receiver is a computer and cannot get wet. You may continue all of your usual medications except any medication, herbal or home remedy, for reflux or heartburn. The receiver will automatically shut off when the study is finished. You will need to return the receiver to the office after the study is complete. You may resume your reflux medications when the study is complete. The capsule does have metal, so no MRIs for 30 days to ensure the capsule has passed. If an MRI is needed within 30 days, please obtain an X-ray to be sure the capsule has passed. If you have any difficulty with the receiver during the test, please complete the study and we will analyze the test the best we can. In summary, the Bravo test is done off of your reflux medications. Push any button to wake the receiver. The screen will turn on. Then push buttons as indicated for eating or drinking or body position. The receiver will automatically shut off when the study is complete. You may then restart your reflux medications. Return the receiver to our office when the study is completed. The capsule will fall off in 7 to 10 days and exit the body with a bowel movement.